Welcome to session 1 of your Growco postpartum rehabilitation program. I'm Dr. Allie Kane, founder of Growco Postpartum Rehab, and I will be leading you through the next 8 sessions where we look at reconnecting you to your core, your pelvic floor, and strengthening your entire body from the inside and out. This isn't a get back to your pre-pregnancy weight or your pre-pregnancy jeans as fast as possible. This is relaying the foundation for the rest of your life. Ladies, in my clinic, I see so many women suffering from these common ailments that stem back to unresolved or undiagnosed issues coming from their pregnancy or their postpartum period. We're skipping all of the necessary work that needs to be done to rehabilitate our bodies after we've been pregnant for 9+ months and delivered our babies, whether vaginally or via C-section. This is the important work that will allow us to thrive for the years to come, and that's my goal for you, to not just survive, but to thrive. You'll notice that most of our sessions are going to be rooted in 4 pillars, which include breath work, core work, postural strengthening, and glute strengthening as well. Those are the 4 key areas that we need to reconnect to, strengthen, and stretch as well in order to lay that solid foundation upon which you can build to wherever you want to go. Ladies, let's get started. Bring yourself on down to your mat. Find a comfy position and go ahead, lay on back. The first part of every class is going to start with breath work. I want you to bring your left hand to chest and your right hand to stomach. Now, for some of you, this is going to take a few sessions to really get the hang of. And never anything that we do is going to be rushed. In fact, we're going to go slower than you think you need to go. This is all about connection and linking our breath with movement. Why? Well, listen up as we start to breathe. With the left hand on the chest and the right hand on the stomach, I want you to take a deep breath in and allow the belly to rise as you inhale. Exhale, belly falls. Inhale in, belly rises. Exhale, belly falls. As you continue breathing at that tempo, I want you to notice how much your belly moves in correlation with your chest. Are you really hunching those shoulders up towards your ears, or is the chest rising? Are you hanging out up here? We want to start to connect down deep into our body and breathe that new fresh air in as fully and as deeply as we can. Continuing to breathe here, allowing your body to melt into the floor. This time is for you. This time is for you to reconnect to your body, which you just shared and brought new life into this world. Breathwork plays an important role in not only connecting back with ourselves, but connecting to our pelvic floor. As you breathe in, your diaphragm pushes down to accommodate all of that new fresh air. That slight press down causes the pelvic organs, so things like your bladder and your uterus, to press down on top of the pelvic floor. What happens here is a synergistic relationship whereby as you breathe in, your pelvic floor stretches slightly to accommodate those pelvic organs, and as you breathe out, there's a slight contraction. We need this gentle movement and flow for a good, healthy, and functional pelvic floor. So let's go ahead and visualize that. Breathing in, diaphragm pushes down, pelvic floor stretches slightly. Exhale out, breath escapes the body. Everything moves slightly up and a slight contraction through the pelvic floor. One more breath in. Exhale out. Good. Draw those knees in towards your chest. You can open your eyes if they were closed and start to rock side to side. That breath work is going to be the link for most of the movements that we go through today. Let's get the body warm and ready to move. So keeping that right knee into chest, extend the left leg long, flex both of the toes up, staying here for a few breaths and allow the belly to expand and press slightly against that thigh. Exhale exhale, draw that knee up a little bit closer towards your armpit. One more breath here. Exhale out. And switch. Left knee into chest, right leg extends long. Allow the belly to rise on your inhalation, pressing against your thigh. Exhale, release, and pull that knee up a little bit closer to your armpit. One more breath in. Exhale out. Both knees back in towards your chest, a little bit wider this time. And I want you to start to draw circles with your knees. We'll draw them counterclockwise and then switching direction, moving clockwise here. Allow the feet to come down onto the mat. Hands can come out into a T position on either side of the body. And we'll start to windshield wiper the knees side to side. Good, letting the knees drop down, listening to what your body is telling you. If this is the first movement that you've put your body through since giving birth, I want you to move slowly. I want you to move in shortened range of motion. If you leave today's session feeling like you could have worked harder, that is a good thing. We want to test our threshold and see where our body is at today, honoring that. Allow the knees to drop over to one side, pausing there. Big breath in. Exhale out. Second side. Exhale out. So now that you know what I'm looking for when it comes to your breath work, as I cue you throughout today's session, come back to that deep diaphragmatic breath where you actually feel the belly expand and then feel that exhalation and everything moving in and up. Let's go ahead and come on to our hands and knees here, moving now into our postural stretching and strengthening portion. Knees come wide, bum comes back on top of the heels. Bring the right hand to the back of the head, rotate that wrist down, and then rotate up in the way, eyes follow, looking past the elbow. That's 1, 2, 3, 4, and 5. Switching sides for 5, 4, 3, 2, and 1. Press yourself up into a tabletop position. Knees come slightly wider, so if you look through your knees, you'll see your toes. Strong through the hands here. I want you to tilt your pubic bone upwards and pull your abdominals tight. Okay, you're not holding your breath here, you're just feeling a gentle activation through your midline. Raising that right hand up and out to the side, I want you to squeeze the shoulder blade in towards the midline. So here, we're tapping into the strength between the shoulder blades and pulling the shoulder blade in towards the spine. For 4, 3, 2, 1, and really hold there, squeeze it in, drop it down, and move it on a 45-degree angle in front of you. Thumb is up here, so we're gonna call this the Y. The one we just finished was your T. So in this Y position now, keeping the arm in a 45-degree position, thumb up, you're gonna think about the muscles on the bottom part of your shoulder blade, pulling them up and down. Now, the tendency here is that you're gonna wanna shrug with your shoulder up. Try not to do that. Keep that shoulder down and away from the ear. For 2, and 1. Good. Second side here, starting with our T's. Resetting that position, pull the pubic bone up, abs engaged, hand out to the side, squeeze for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Move the hand to a 45-degree position. Thumb is up. Bring that arm up by squeezing the shoulder blade back and in. Again, reducing or avoiding the shoulder shrugging up or the shoulder coming towards the ear. Instead, we want to think about the shoulder blade sliding back and down. 3, 2, and 1. Firm that hand down, round the back up, tuck the chin towards your chest in your cat position here. Drop the chest down, eyes come up to the ceiling cow. Good, whatever speed feels good for you here, moving all of the vertebrae of your spine. Something to note here, if you did have an epidural, oftentimes you will feel a little localized spot that feels a bit more tender. If it's anything ever more than just like a 2 out of 10, that would be a good indication to stop what you're doing or to reduce your range of motion, to reach out to your healthcare provider and ask them about what you're feeling. 2 and 1. Good. Firm the hands down, tuck the toes under, push up and back, downward facing dog. In your down dog here, pressing the heels towards the ground, firming them down, but it's always okay if they don't touch. Everybody has their own unique anatomy and range of motion. The head pushes through the biceps, the ears come through the arms for a really big stretch. Firm yourself forward, tap those knees down, untuck the toes, moving back into a child's pose. Now, if that felt really good, you can go ahead and hit pause and flow through that all again. If you're ready to move on with me to the core, let's go ahead and bring ourselves down onto our backs and start with our very first core exercise, one of my favorites, the dead bug. So coming down onto your back here. Now, as I mentioned, everything is linked with breath, but it's also linked with connecting to the core. We're not worried about how much work we can get done, how fast we can get done. We want good quality repetitions where we're feeling our pelvic floor and our core come alive. So in this position here, I want you to bring your hands on either side of your hips with your fingertips facing inwards. So the fingertips are in towards the navel. Now ladies, this is the orientation of your deepest core layer that we call your transverse abdominis, or your TVA for short. So it is underneath your six-pack muscle, which runs up and down. These muscles run horizontally. Now this muscle, when we're able to activate it, is what gives us full body strength. It allows our back to be strong. It allows our body to be functional. It's an area that will likely be weak, and maybe you may feel very disconnected to if you're in your 4th trimester, just 12 weeks postpartum, or if you've never done any focused rehabilitative work after you've given birth. So in this position here, I want you to take a big breath in, exhale out, and as you exhale out, you're going to think about narrowing your waist inwards so the fingertips come in. Now the tendency here is going to want to be to suck your belly button in or suck your stomach in. That's not what we want here. We want a narrowing of the waist and a tightening or a drawing inwards of the fingertips towards one another. It's going to take some work, so don't get discouraged if you can't feel anything today. I promise with the work we're going to do, you're going to be a master at this by the time we're finished. Take a deep breath in. Exhale out, tension. One more time, big breath in. Exhale out, tension inwards. All right, ladies, from here, peel the feet off the mat. Your knees are going to come wider than your toes here, and your knees are going to be bent. Your hands come up towards the ceiling. This is your dead bug position. In this position, I want you to slightly tilt your pubic bone up. Right away when you'll do that, you'll notice that your core will kick on and your low back will flatten slightly against the yoga mat. In this position here, I just want you to breathe. Take that deep breath in. Exhale out, tension inwards. You should still be able to talk in this position. We're not sucking our belly button in. Big breath in. Exhale out. 3 more here. For 2. Really tension inwards. Last one, breath in, belly rises. Exhale, activate that TVA muscle. Good. Bring those knees to chest, little rock side to side. Ladies, that may be where you stay today. If you had any shaking, any low back pain there, or you weren't quite connected to being able to feel that drawing inwards of that TVA muscle, that exercise is where I'd like you to stay for another set of 5. If you felt generally good and you'd like to advance it, then follow along with me on this next progression here. Everything always starts by linking to the breath and activating that TVA. So bring your body back up to that dead bug position, pull the pubic bone forward, big breath in. As you exhale, you're gonna drop your leg 2 inches forward. Notice my knee is still bent. Good, and then I'm gonna bring that leg back. Breath in. Exhale, tension that TVA, second side, leg moves. Continuing like this, the leg only moves in as much range of motion as is necessary for your body to stay as still as possible. So we're looking at keeping connected through the low back to the ground. We're reducing any lift or shift through the core. So if you start to lift like I am here where my ribs start to flare off, my leg is moving too far. The goal here, ladies, is how much control, how much stability can you create through the midline. This is true core activation. This is true postpartum healing. Let's do one more per side. If you're breathing with me, continue to take those deep belly breaths in and out. One last one together, big breath in. Exhale out, tension TVA, drop that leg. Good, bring everything back in, little rock, side to side, beautiful. That is one of our foundational movements here at Growco, and you'll notice that each and every session will give you a range of progressions or scaling options where you should be at. And I want to take this time to remind you that I am not you and you are not your sister or your friend who's given birth. Our bodies and our anatomy and our journey are all unique, and we want to honor that as we rehab our bodies. For our second exercise today, I want you to bring yourself into a tabletop position. Now, mommy thumb or really sore wrists can be quite apparent in this stage postpartum. So if the wrists are ever really sore, option to come down to a fist or option to come onto your forearms. I never want you working through pain. It's just going to make it worse, and it's just going to prolong the healing of the wrists. So in this tabletop position, knees come wide so you see your toes. We've essentially just flipped that dead bug position upside down. Hands firm down into your yoga mat, and you're going to spin the pits of your elbows forward. Pull that pubic bone up, activate through the lower part of your abdomen. In this position here, I want you to simply breathe in and let everything relax down, like your belly should be hanging right down there. Inhale, draw the belly up, but also inwards. We're once again tapping into the connection to our TVA muscle. Big breath in. Exhale out. How you doing there? One more. Big breath in. Exhale out. A little bit tougher now because we're having to overcome gravity. So maybe you stay with that breath work here, or our progression today is going to be hovering our legs above the ground. Once again, recall that we're linking breath, we're pre-activating the TVA, and the only reason we're moving any of our limbs is to challenge our core. Follow along with me, big breath in, exhale out. I want you to lift your right knee 2 inches above the mat. Check in with your body and make sure that the hips are still staying focused towards the floor and that you haven't elevated anywhere. You're as still and stable as possible. Drop that knee back down. Big breath in. Exhale out, activate TVA, lift that left knee 1 or 2 inches above the mat. Again, trying to stay as still and stable as possible through the midline. Breath in, exhale, lift. Back down, inhale, exhale, tension TVA inwards, lift that left knee and hover. Drop that back down. 1 more time per side. Breath in. Exhale. Tension. Lift. Keep everything so still. Drop that down. Left side. Breath in. Exhale. Lift. Drop that knee. Come on back. Child's pose. Excellent job. So what we're doing here, besides creating that stability and that control and that connection, is we're looking to find where we're at today so that we can stay within that threshold. As I mentioned, there's no use in just flailing about and doing the reps just to get them done. The goal here is to be as connected as possible to these areas of our body that likely feel weak, that you likely don't feel control over today. So those are 2 of the core exercises that you will see throughout our series here, the dead bug and the bird dog. We're going to now move towards our glute exercises as well. Now once again, please move within the range of motion that feels good for your body. Come on back into your tabletop position, but come on down to your forearms here and extend the right leg back. So my big toe is touching down. I'm going to lift this leg up and squeeze my bum at the top. So I'm lifting and squeezing. So beyond just lifting that leg, I'm consciously giving my bum an extra squeeze at the top. And we're continuing to move up and down for 10, 9, 8, make sure you're breathing, 7, 6, 5, 4, 3, 2, and 1. Drop that leg down. Second side extends back, big toe down, start to lift. Squeeze the bum at the top, control it down. Keep it going for another 10, 9, 8, 7, really squeeze, 6, 5, 4, 3, 2, and 1. Good. Drop it down onto your side here. Support the head, however feels comfortable for you. Draw the knees upwards and bring the heels together. Your hand comes onto your top part of that hip, fingertips forward, thumb in the middle part of the glute. Where your thumb is right now is the muscle we'll be using to draw this top leg up. Lift through the heels or keep the heels down. So heels down would be like a level 1, heels up would be a level 2. So wherever you're at, from here, keep the heels together and start to pulse that top leg, or that top knee rather, away from the bottom knee. Toes move apart, heels stay together. We're drawing up with that muscle right underneath your thumb. Very good. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Switching sides. Lifting at the heels. Hand on that top hip, thumb right in that middle meaty part of your bum muscle there. Keep that leg moving up for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Take a little break here, grab some water. Why we like to look at the glutes in the postpartum period. Two reasons. One, you've just grown a baby, so your entire body has shifted. Your pelvis, if we looked at how it looked before pregnancy, during pregnancy, and after pregnancy, has actually tilted. This can sometimes cause different issues through the glute muscles that can cause poor posture. It can cause low back pain, and sometimes it can even cause pelvic floor dysfunction to link back to your glutes atrophying or the muscles wasting away. Now we'll get into that in subsequent videos, but that's why we want to really connect and squeeze that bum muscle in these movements here to support our posture, to support our low back, and to support our pelvic floor. Let's move through that one more time. So coming onto your tabletop position and then down onto the forearms, kick your leg back and start to lift, squeezing that bum at the top part of the movement. We've got 10 more. 9, 8, 7, really squeeze. 6, 5, 4, 3, 2, and 1. Bring that knee down, extend the left leg back, start to lift. 10, 9, 8, 7, 6, that's it, stay with me. 4, 3, 2, and 1. Drop it down onto your side. Moving into our clamshell exercise. Lift at the heels or keep the heels down and start to lift that top knee up and away. Good, feeling the activation or the squeeze of the muscle right underneath the thumb. 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good, switching to the other side. Final 15 reps in today's program. Let's move. For 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Beautiful job. Bring yourself back down onto your back. Water if you need it. Settle in wherever you are for a few minutes here as we finish by bringing our heart rate down and reconnecting to our breath. Legs can go in whatever position feel right for you. Maybe knees are bent or knocked inwards, or maybe they're out to the sides. Left hand comes to chest, right hand comes to belly. Close those eyes. And I want you to allow your body to melt right down into the floor. Deep breath in, belly rises. Exhale out. Sending you gratitude for carving out this time for yourself today. This is the important work that we do now to avoid all sorts of issues and complications later on in life. The slower we go, the faster we see results. You're going to learn a lot throughout our next sessions together, the reason why behind we do what we do. These deep belly breaths here are something that I encourage you to do throughout the day. There's really not an upper limit for how often you can do this, and the payoff, it's massive. One final breath in for 1, 2, 3. Pause at the top. Exhale. 3, 2, and 1. Ladies, thank you so much for joining me today for Growco Session 1. I cannot wait to see what we create together over our next several sessions together. I'm Dr. Ali Kane. Reach out to me at Dr. Ali Kane or at growco.rehab. My DMs are always open, and I'm here to help you and help connect you to a Growco professional. Cheers.